Growing up in Nigeria, I witnessed the ecological devastation caused by oil spills across the country. And this led me, after my first degree in the sciences, to work with the Nigerian National Petroleum Corporation, NNPC. This is the state-owned company that is responsible for the production, exploration, and marketing of petroleum products. During that time, I served a team that was remediating oil spills across the country. And I realized the role that microbiology could play in the remediation of oil spills. And so I was inspired to pursue a PhD in environmental and applied microbiology at the University of Georgia. However, during the time, I came across a well-renowned microbiologist by the name of Ananda Chakrabarty. He was the first person in the world to create and patent a genetically engineered organism, in this case, a genetically engineered microbe that could break down crude oil into water and carbon dioxide. Massive potential for bioremediation. And so I interviewed him. The results, which were published in Technology and Society, and the results indicated that although this promise, this potential for impressive remediation, it was literally sitting on the shelf. Now, it is well known that the history of innovation is littered with failure, but to see that obvious potential trapped in the lab was shocking to my younger and more idealistic self. But over the years, I came to realize how often the bridge from the lab to the village breaks. And not just in the context of oil spill cleanups, but in the context of global health innovations, which is what I want to talk to you about today. You see, every scientist, engineer, politician, and entrepreneur at one point or another experiences this delivery gap. Having knowledge about what works is no guarantee that it will reach those it's intended for, and maybe global health knows this story best of all. And this is because scientific breakthroughs alone are not enough. It is scaling these breakthroughs that is everything. And history has already proven this. Let us imagine for a second if smallpox was never eradicated. A quick back of the envelope calculation suggests that today 5 million lives will be lost every year. And those who survive will be tainted with disfigurement, scars, and permanent blindness. So what did the scaling up of the smallpox vaccine entail? Well, it involved the mass production of these vaccines. It involved worldwide distribution. It involved aggressive campaigns driving the virus to total elimination and eradication in 1980. The success of the vaccine was not the breakthrough. No, sir. It was smart strategic scaling. And in fact, this lesson became clearer to me 8 years ago while working as one of the first fellows of the Every Woman, Every Child Innovation Marketplace. You see, this is a global health initiative that is focused on scaling up health innovations for maternal and child health, consisting of major global health funders, including the Gates Foundation, Grand Challenges Canada, UBS Optimus, the United States Agency for International Development, and many others. My goal at the time was to curate and broker these innovations to help improve maternal and child health. One key insight I gleaned from that experience was that it wasn't the most promising innovations that were getting the most funding. No, sir, it was factors like the novelty, the sexiness, the innovator's profile, and many others, often overshadowing true impact. And so it seems that there is a certain movement of scaling up evidence-based innovations being paid little attention. And a great example of this is an analysis that was done also in maternal and child health using the Global Innovation Exchange database. So one of the largest databases of global health innovations. And in the maternal and child health space, there seems to be a heavy focus on new discoveries, funding new discoveries. At 36% of the funding going into that, approximately 72 million, while less than half of that goes into scaling up what works. I would like to crave your indulgence to posit 5 reasons why we need a paradigm shift now more than ever before towards scaling up evidence-based breakthroughs in the context of timing, impact, cost effectiveness, equity, and a scale-up structure. First, timing. We are at a pivotal moment in the trajectory of health innovation discoveries. In the last 100 years, we have witnessed an unprecedented surge of breakthroughs from vaccines and antibiotics to digital health, far surpassing the cumulative evidence in the previous 10,000 years. And for example, even in the 20th and 21st centuries alone, we have developed vaccines for polio, measles, hepatitis B, diseases that at one point caused widespread morbidity and mortality. For example, polio has been almost eradicated. About a century ago, that feat would have seemed almost impossible. The second reason why we need to move towards scaling up what works is because of the impact and the life-saving potential that these innovations have. It therefore makes sense that you want to extend the reach. Take, for example, the expanded program on immunization. That program prevents 2 to 3 million deaths every year. However, here's the kicker. If the program and vaccines were spread to universal coverage, we could save an additional 1.5 million lives every year, showing that the full impact of these innovations are not realized until they reach everyone who needs them. The third reason why we need to move towards scaling up what works is because it's more cost-effective and efficient to scale up what works, particularly in the context of low resource constraint settings, which is a prominent feature in global health. The expansion of insecticide-treated bed nets has been far less expensive than actually creating new malaria treatments. At just $2, including installation and delivery, we've seen the incidence of malaria reduced by over 50% in several African countries, showing that through scaling up these innovations, we can deliver impact, maximize resources, as well as cost. A fourth reason why we need a paradigm shift towards scaling up what works is because when these innovations are scaled up, it does reduce and narrow health disparities, regardless of social economic status or class. So take, for example, when vaccination programs are expanded and scaled up, it gets to all children, rich or poor, further narrowing the disparities. I witnessed this firsthand when evaluating the meningitis vaccine, MEN-Afrivac, across the meningitis belt of Africa. You see, meningitis is one of the most feared diseases in the continent. And meningitis very quickly causes severe brain damage as well as deaths every year across the belt that is plagued with continuous epidemics as well as an extremely limited access to vaccines. However, in 2010, with the introduction and rollout of the vaccine, everything changed, driving and actually virtually eliminating the disease. It further showed to me then that with such a breakthrough being scaled up, we can narrow health disparities as well as protect vulnerable communities. The fifth reason why we need a paradigm shift is because when we focus on scaling up what works, we actually build a foundation of infrastructure, support systems, and knowledge that can be used in scaling up other future discoveries. The worldwide distribution of COVID-19 vaccine was a great example. Why? Because it leveraged the lessons from polio eradication, actually building upon global coordination, global surveillance, mass vaccination strategies, community engagement, the logistics, the infrastructure, leapfrogging over challenges to ensure the worldwide distribution of the vaccine. In fact, decades of global health initiatives acted as support systems for that success. And so with these compelling reasons that anchor the urgency of actually scaling up what works, where do we go from here? What ways can we move forward? Well, one idea that I have, and which I'm sharing for the very first time, is the development of a high impact innovations list, a strategic tool that identifies and elevates the most promising innovations that can provide the most potential for improving population health. Such lists are not unprecedented, as the World Health Organization maintains several critical lists. One notable example is the Essential Medicines list that is used to prioritize essential medicines for public health. My proposed list would involve and be spearheaded by the World Health Organization and global leaders. It would require the integration of a diverse global health team of experts, epidemiologists, health economists, and of course, affected members of communities. The tool will set clear metrics for the adoption of these innovations into national plans, as well as provide a benchmark for investment priorities, ensuring that these innovations are able to reach those who need them. With such a list that is focused on impact and proven innovations, on ensuring that these innovations can demonstrate the highest impact for population health, as well as cost effectiveness, we can save and improve millions of lives with so much efficiency. And so in closing, as we move into the future of global health, it is crystal clear that prioritizing what works and not waiting for the next big discovery is the best opportunity to save and improve most lives. We should push for bold policies and champion tools and frameworks such as the High Impact Innovations List that prioritizes and scales up these innovations to ensure that they reach all communities who deserve it. By driving our efforts towards scaling up what works, we supercharge our predictive capabilities to address the most stubborn global health challenges, maximizing resources and ensuring that the bridge from the lab to the village remains intact. Thank you.